Hi, I'm Dr. John Martin with Ivy Family Health Updates. I'm here with my sister, Dr. Catherine Martin, and my brother, Dr. Ed Martin, and we're going to talk a little bit about facelifts. Now, my background is in ophthalmology and then oculoplastic surgery, and in the past several years, I've also been doing facial surgery, which includes facelifts, neck liposuction, and brow lifts. And what I'm going to talk to you about today is facelifts, because there's a lot of confusion about what's a facelift, what's a mini lift, what's a lifestyle lift, and I just want you to get an understanding of what is the difference and who are they for, because that I think will help you at home understand the difference between all these different procedures. Basically, any facelifting procedure is going to help with jowling, it's going to help with the neckline, and it's going to help improve the overall appearance of the wrinkles in your skin in the lower part of your face. So what we're going to talk about is lower facelift. Now, some of the newer lifts, such as a mini lift, what that means is that you aren't going to have as big a lift. You're going to have a smaller incision, you're going to have less dissection, so you'll have faster healing, less bruising, and it's really for the younger patient who doesn't need as much of a lift. A more full face lift involves more dissection throughout the face, usually involves some neck work, and also involves a longer scar. So that's really the main difference between the two. One is more for, obviously, for the younger patient who doesn't need as much, but for an older patient, you really need to do more if they have more skin laxity, less elasticity in their skin, more jowling, more fat in the neck. And so one procedure may be great for one person and not for another.
And what kind of ages are you talking about here? Who's the patient who is becoming the younger age?
Younger age is probably 40 and up. I know 40 sounds sort of young, but even at 40, some people also already have some jowling or some fat in their neck, and that's a genetic predisposition to be getting that. Usually the best time for facelift is sort of late 40s, early 50s, because at that age you still have a lot of elasticity in your skin. You'll get a more natural appearance. You won't look quite as pulled because there's not as much to pull. As you get more, a little bit older into your 60s and 70s, usually you have a lot more skin to be pulling at that point. There isn't as much elasticity, so that you tend to get a little bit more of that tugged appearance. Another issue with facelifting is when people talk about the very unnatural look. That really comes from pulling in the wrong direction or taking a lot of fat out of people's faces. If you take a lot of fat out of people's faces, you'll give them that sculpted look, which looks great when you're 35 or 40. But when you're 60 or 70, it just makes you look like a cadaver. So we now never want to take that out of people's faces. If anything, we try to inject. We'll sometimes take it from your hip or your abdomen and inject it into your face to sort of fill out the face. But let me show you a couple of slides so you can see exactly what I'm talking about here. Now, when we do a facelift in a woman, what we do is make an incision that comes down from here, usually starts under the hairline or up into the hairline, depending on the hair tuft. Comes down, goes inside the ear, then back out under the ear. Now, in a mini lift, an S lift or lifestyle lift, it usually ends just right up behind the ear in here. If it's more of a full face lift, it will come back up behind the ear and back down along the hairline, and I'll show that in just a second. Let's start with a mini lift or an S lift. What we usually do is start below the hair tuft or up into the temporal hair area, depending on the amount of hair you have, then come back down inside the ear, and then you scoot up just behind the ear here, and this would be the incision for one of your smaller lifts. These are the sutures that you would put underneath the skin for an S lift. You have one suture that starts up here, comes down, lifting and pulling all this tissue underneath up, and then you have another one down in through here. These are underneath the skin, and this is characteristic of what we call the S lift. Now let's go back to our incision again. Here we have underneath the tuft, back down inside the ear, and then back up behind the ear. If we're going to be doing a fuller facelift where we have a lot of redundant skin, instead of stopping here with the incision is going to come up behind the ear, and there are a lot of different variations. You can go down along the hairline, you can go into the hair, you can scoot up in through here, but you're usually going to need to extend your incision to be able to get up the redundant neck skin. What this shows is when we're going to be doing one of the larger facelifts, this is underneath the skin. There's a tissue called the SMAS. And what we do is we pull the SMAS up in this direction and tack it down up here, and that tightens the underneath tissues. It also helps decrease the jowling, and this is what gives you your two-layer fold. So this is underneath the skin, not on top of the skin, and then your skin incision is here around the ear. This shows where we're going to be dissecting to underneath the skin. So we come out through here, and so when we dissect in through this area and then pull up the skin in a more vertical direction like this. Remember, I said we don't want to pull horizontally or you get a very pulled appearance to the mouth. Now, who's the surgery for? Well, this patient doesn't have a lot of jowling or a lot of neck laxity, so she'd be a perfect patient for one of the mini lifts, an S lift, a lifestyle lift, one of those lifts. And you're just going to be pulling up in this direction to help with the jowling and the neckline. This patient has a little bit more jowling, a little bit more neck laxity, so you may need to go a little bit higher up behind the ear. Also probably do a little neck liposuction. And in someone like this is going to be a lot of work. You're going to need to do some neck liposuction. You're going to need to tie the platysma, which is the muscle here, which causes the banding. You're going to have to tie those together. Then you're going to have to take out a little bit of this jowl fat. Then you're also going to have to pull all of this. So she's going to need a fairly long incision to really give some improvement to the appearance of this very lax face. Now, the lift that I usually like to do would be what we call the SMAS plication. That's the one I showed, where from the underside we do a line of sutures pulling all the deep tissues out and then pull the skin up on top. In addition, sometimes you need to do some neck liposuction. Sometimes you need to close the platysma, which is the muscle underneath it. People have the deep bands. And then also you can do upper, things in the upper part of the face, a brow lift, do the upper and lower lids as needed. Now, there are certain what we call corporate lists out there now. I'm sure you've heard them advertised, where they talk about you do the surgery, you go back to work, and then you go to lunch with the girls, go to work in the afternoon. Surgery is surgery, and it really is misleading. That advertising is misleading. I've seen some of the patients post up, and for the most part, the patients look pretty good, but their biggest complaint is that they didn't take enough time off from work because they really underestimated the time they were going to need to recover. And people get bruised, people get swollen. It depends on your skin. It depends on a lot of different factors. The other complaint, if you go to the internet, that's the same complaint that people have. A lot of them are very happy with their results. They're just not happy because they didn't plan to take enough time off. The other big consideration is those sort of lifts really work best for younger people. So if you're an older person, that is not going to be the best lift for you. And I have seen a couple of patients who have had probably just the incorrect lift done for the skin laxity that they have, and they needed more done. They needed more dissection, more pull, neck liposuction, different things done than were done on them. Another important thing is when you go in to see your surgeon, look at some before and after pictures. Now, obviously, everyone's going to heal a little bit differently, but at least it gives you an idea of what their aesthetics are, what they think is a nice result. And remember that in people's books, they're going to have good results, not bad results. That's another problem with some of what I call the corporate lifts, is that if you go to their website, some of the pictures, if the before picture of the patient is like this, and if the after that like that, well, their neck is going to look significantly improved because they have stretched it out. So make sure that the before and after pictures are taken with the same lighting and from the same angle, because that gives you a much better indication of, what the real results are. Right? Any questions at all?
So how much time, you mentioned that you're not right back to work that day?
Yeah, you're not going back to work. You're not even going back to work in 2 days. For a facelift, I usually tell people to take 10 days to 2 weeks, because I think if you take enough time, you're not anxious about the healing process. If you get a lot of bruising, it's going to take a good 10 days to 2 weeks to go back to work. And I think that if you give yourself that time, you'll actually heal a little bit better. I think, because you're much more relaxed about it. If you tell people they're going back to work in 2 days, chances are very slim they're going to go back to work in 2 days, and they're not going to be happy with you because they're just not going to be ready, to take the time off. So, all right.
Thank you.